Growing up, my mom was a physical therapist, so she was my first exposure to healthcare. My grandma had 2 knee surgeries individually, and she didn't speak any English, so I would stay with her during her hospital stay, post-surgical recovery. I was really in the hospital for like a week at a time on 2 different instances, and that's kind of what helped me see the whole picture of healthcare, like how the doctors and nurses and therapists all work together. And then in undergrad, when I volunteered and started working in the hospital, I saw that there were a lot more departments other than physical therapy. So that's what made me interested in medicine, was to learn more about every single department in the hospital. The reason I liked endocrinology was because during residency, I had a really good mentor, and that made a big difference in the career that I chose. And with practicing endocrinology, it's very rewarding treating patients over long periods of time. You really get to build relationships with them and kind of helping them through their concerns and medical questions is rewarding. And endocrinology specifically, I really enjoy diabetes and working with patients on a personal level, and I feel like you get that continuity of care with endocrine because a lot of the patients come back for multiple visits, so I really get to see their lives change too. I think my philosophy of care is very patient-centered, and I really want to focus on getting to know you and your concerns and your questions, and I really want to make sure that you leave the visit with all of your questions answered and that you know more of what the trajectory is in your health, not just what's going to go on for the next 3 months or 2 months. And I just want you to feel empowered, I guess, with the information, and I want to work together to come up with a decision with you versus, telling you what you should do based on what I recommend.